Evidence of a link between the Zika virus and a neurological disease in newborns is growing increasingly certain. That's according to the director for Centers for Disease Control, who testified on Capitol Hill today. Federal health officials are urging lawmakers to approve a $1.8 billion emergency funding to fight Zika, a mosquito-borne virus, which has now spread to dozens of countries. For more on this, we're going to go now live to RT's Marina Portnaya in our Miami studio. Marina, so the CDC director was speaking to the Senate Appropriations Committee when he cited brand new research linking Zika to microcephaly. What do we know so far?
Well, Manila, health officials in the U.S. and around the world have been very careful to use the word linked when describing the relationship between Zika and microcephaly. This essentially means that it's not absolutely scientifically conclusive that every single pregnant woman who is infected with Zika will have a baby with microcephaly. However, the brand new research the CDC director, Tom Frieden, unveiled to lawmakers on Thursday relates to 2 infants in Brazil who tragically died within 24 hours after being born. Their mothers were infected with the virus while pregnant. Take a listen to what the CDC director said.
Working with our Brazilian colleagues, the CDC laboratory was able to identify the genetic material of the Zika virus in the brain tissue of the 2 infants who died with microcephaly. This is the strongest evidence to date that Zika is the cause of microcephaly.
Mr. Frieden says the evidence isn't definitive, but the causal relationship between Zika and microcephaly is looking increasingly certain. Now, before the Zika outbreak in Brazil occurred last May, the country reported roughly 150 cases of microcephaly. Now, more than 4,000 cases of microcephaly have been reported in Brazil, which is why the world has become increasingly concerned about Zika's effect on pregnant women and on women planning to get pregnant.
Now, Rena, what about prevention? What about the prevention of Zika here in the United States? Even though Congress is likely approving this $1.8 billion of emergency funding, the CDC isn't really guaranteeing that cases of Zika won't continue to increase here in the States, right?
Right. There's been no guarantee, and the CDC director is very honest about this. He told lawmakers that we'll see more Zika cases among travelers to the U.S., and some of them will be pregnant, and we may also see more cases of local transmission. But the primary objective is to take as much possible action now to reduce the threat to pregnant women. That includes investing much more in testing and in mosquito control. The Aedes aegypti mosquito, the species that spreads the virus, is very hard to get rid of. This is something the CDC director said. Now, this mosquito is located here in Florida as well as many other states throughout the U.S. Listen to how Mr. Frieden described the mosquito during his congressional testimony.
It's an indoor biter. It bites all through the day, including at dawn and dusk. It hides in closets and under tables and places that are hard to get to. Its larvae or eggs its eggs can be drought resistant and can persist for some time. And it can bite 4 or 5 people in the course of one blood meal, meaning it can spread disease quite quickly. Our efforts to control it are challenging. It's hard to eliminate.
Now, the most important thing is to make sure that the species of mosquito that can carry Zika, that mosquito does not bite someone that comes to the U.S. already infected with Zika. Now, in addition to mosquito surveillance and forming better testing, the CDC says the emergency funding will also be used to develop a vaccine for the Zika virus, which currently doesn't exist. It's also important to point out, Manila, that the CDC claims that it is not aware of any other virus that has caused a significant number of birth defects in the past 50 years. This is something that federal health officials are taking very, very seriously.
Definitely a very terrifying description of this mosquito. Thank you so much for that. That was RT's Marina Portnaya reporting from our Miami studio.